10%. Childhood health assessment questionnaire was also applied. Initially it was before Actemra 2.93 and now it is 0. So the conclusion is that in summary this case reflects successful use of tocilizumab Actemra for refractory systemic onset juvenile idiopathic arthritis. Thank you.
Thank you very much. The next speaker is Dr. Saira Khan from Fatma Memorial Hospital, Lahore.
My name is Dr. Saira Khan and I work in the Division of Rheumatology in Fatma Memorial Hospital. I would like to introduce you to a study that was performed in our department regarding the dietary intake of calcium in adult female rheumatology patients. As you know, calcium is a very important mineral for bone health. It is much more important for our patients because they are susceptible to bone loss on account of a number of factors. The very chronic nature of the disease, coupled with immobility, lack of exercise, and prolonged steroid use leads to significant bone loss. And this is the reason why calcium intake is very important, and this is the reason for this study. Before I start, I would like to remind you the adult requirements of calcium. For this study, the significant point was that the requirement of calcium is 1000 milligram to 1200 milligram. This was the main objective, to test the dietary intake of patients. As I mentioned, it was performed in the Division of Rheumatology, Fatma Memorial Hospital and National Hospital, Lahore. A 9-item questionnaire was prepared to test the patient's knowledge, attitude and practice. The patient group comprised of about 280 female patients. However, 115 female teachers were asked to fill up the questionnaire as controls. The dietary intake of calcium was far more among the patient group, with a mean of about 860, whereas in control it was only 532. I would like to emphasize in this slide that although the awareness of the importance of calcium was more among the control group of about 98%, the patients were far more diligent in the intake of calcium. The mean dietary intake among patients was about 860 milligram, and they also took far more calcium supplements as well. Milk was the most popular product taken, and it was taken equally among the both groups. The patients took about 6 glasses per week, however, which was 1 more glass than that of the control group. And the important and among the tablets, the chewable was the most important tablet preferred by the patient. When asked if they would take a calcium supplement, most of the patients said that they would, which shows their attitude. In short, I would say that although this study is just a beginning, but it does emphasize that calcium intake among patients is.
Then he was switched to monthly pulses at the same doses. After 7 months of this therapy, he had a 40% improvement.
Optimal, and it needs to be emphasized. Thank you.
Thank you very much. The next presenter is Dr. Samia. She works in Children's Hospital, Lahore.
Assalamu alaikum. I am Dr. Samia, and today I am going to describe a study that is relationship of joint deformities with various parameters in patients with JRA. This is my hospital, the Children's Hospital, Lahore. The objective of this study is to determine the relationship of various joint deformities with clinical and lab parameters in patients with JRA. This was conducted in Children's Hospital, Lahore over a period of 3 years. This is a cross-sectional analytical study, and data was collected at first clinical visit, which included age and